This is Keith Reynolds, and that gentleman over there is Robert Sierra from Ivy Rehab. Robert, good morning and welcome to Morning Coffee.
Good morning. Thanks for having me.
You're welcome. So let's talk a little bit about Ivy Rehab and what you guys got going on over there. Sounds like a pretty awesome place. We were talking a little bit before the show. You guys are a full-service rehabilitation facility providing physical therapy and all sorts of help and healthy options for your patients. But you guys have something very special going on over there as well. So why don't you tell everybody out there a little bit about the dynamic that you have going on at Ivy Rehab?
So what makes my office a little bit unique is that not only are we a full-service PT practice where we basically serve the entire lifespan, everything from children all the way up to old adults, we have a built-in fitness center. So our fitness center is something that we utilize because it allows us to be able to extend our treatment without really having to worry a whole lot about insurances, co-pays, that kind of thing. It's a great way to kind of sidestep that, because in today's healthcare environment, a lot more financial responsibility has been placed on the patient. So this way, instead of having co-pays that could be $60, $70, $80
A visit.
Yeah, each visit.
Yeah.
This way, you could pay just $30, $40 for 1 month. You'll still be in-house. You'll still be able to do the program that your PT, whether it be me or one of my other staff members, derives for you. And then this way, you can essentially complete your entire program and be under our supervision without having to worry about the limitations that insurance companies put on us.
And what's cool about it is that it is a health and fitness center. It is not a gym. It is not a muscle-bound, lunkhead type place
No.
where people are going to be intimidated to go and work out. It is a comfortable environment where you're working on your body and you're working on your health and your fitness, but you're also under the care of trained professionals. And yes, other gyms have trained professionals, but the fact that Ivy Rehab is connected to this gym, it really gives an all-encompassing and a full scope of treatments and ranges of how people can live a better life, because you're there. And they're paying a much lower rate to be a part of the gym, which you should be doing anyway. But then you have the opportunity to be able to help specific problems and needs of people coming into the building. And like you mentioned earlier, for that really low rate, you could go 7 days a week if you wanted to. The gym is open, right?
It's open every day. Every day.
So,
and when you're a patient, you obviously have to abide by a certain appointment time, because that's kind of the spot that's set out for you. Well, with the fitness center, you don't really need an appointment time. You could show up whenever is most convenient for you, and chances are at least one of us will be there.
well, a physical therapist, that was going to be my next question, was that obviously you have staff that are working the gym, but the physical therapists are the ones that could truly help with the specific exercises and all of that stuff. And when people go, you said that there are 4 trained physical therapists on staff.
Yeah.
There's always one of them are there to help people if they have any questions or anything like that. And it's such a unique advantage that Ivy Rehab kind of has over everybody else, is that you're almost monitoring people in a different type of way.
You look at some of the other gyms, and there's a lot of trainers, and there might be maybe one PT that's kind of milling about. At our facility, we have 1 trainer, and there's 4 PTs that are kind of milling about. And all of us are cycling in and out of the gym. We're going into the clinical area, we're going into the gym, because a lot of our patients, even during their treatment session, they're still utilizing the gym, and they're utilizing the equipment that we have out there.
Right.
So we're always cycling in and out. So even if you have a patient that's out there just working out, that's not on an appointment, so to speak, they're just kind of doing their thing, it's actually rare for someone to not ask me a question. Everyone's always just like, hey, I'm working on this kind of felt funny, what do you think? And then right then and there I can give them instant feedback, show them what they need to do, what they don't need to do, what they might be doing right or doing wrong, and correct it right there, and then they can continue on. So it's a really cool thing.
Yeah, it's a really interesting dynamic. I like that idea, because we were talking about a scenario of somebody that comes in and their insurance copay is literally $80 a visit, right?
Yeah, yes.
Every time they come, and the doctor says, all right, well, I want you to have physical therapy twice a week. And you look at it and you're like, well, wait a second, insurance is only giving me an $80 copay. That's $160 a week. That's a lot of money. And this gym offers a pretty amazing alternative to that. Look, there are going to be times that even when you're working out in the gym, Rob's still going to need to get you in for an appointment.
Right.
If you're injured, it's going to happen. But this is a nice way to be able to kind of economically monitor people's health and make them live better lives in a really kind of easy way, I think.
Yeah, absolutely. So like you were saying, that scenario where you have a patient that has an $8 copay, I mean, you're looking at almost $600 a month.
Yeah.
600 plus bucks. Where for $30 or $40, you can come in, utilize the gym whenever you want, and then if you do maybe 1 or 2 treatments in between there, you're still far under that $600 mark.
Real quick, where are you? We want to make sure, I know we're going to talk about that at the end, but just in case people are wondering now.
We're in Cinnaminson, right off of Route 130. So where the Sam's Club is, we're located behind them.
Oh, okay, cool.
So Sam's Club, and there's a Walmart where you follow that little winding road back.
Yeah.
We're located back there.
Yeah, so it's easy. In other words, it's easy to find. It's right off Route 130 in Cinnaminson. So that's another advantage, is that you're not searching off the beaten path somewhere. It's easy to get to. It's easy to get in and out. So
yeah, we have a strong community following as well. Like after the tragedy of Sean Cullen,
yes,
we've spent a lot of time raising money for the family because we know the family. So we've done a lot for that as well. So
That's excellent.
We're a big community-based kind of practice as well.
That's nice to hear. It's always it was obviously a terrible tragedy what had happened, and it was very sad. But it's something that positive that can come out of it is when the community rallies around an event like that and really tries to heal the wounds as best they can as a community and as a group. That's really a special thing.
Absolutely. So Rob, what are some of the things that, some of the things that you're rehabbing people for? Like, what is something trending? Are you seeing a lot of athletes? The ACL seems to, that's like a big thing.
Yeah. In all honesty, we see everything. I don't really think that there's any one condition that kind of supersedes another. We see, you name it, we see it. Everything from, your kind of run-of-the-mill ankle sprain to something a little bit more invasive, like maybe like a stroke. Like we see a little bit of everything.
Okay.
So.
Yeah, because I know, I think because of the media, we know more about ACLs,
Right.
meniscus tears, stuff like that. We're seeing a lot. I mean, I see a lot of that because I'm a big sports watcher. But
A lot of the stuff that we do, especially for those kinds of injuries, is we really work on prevention. There's a lot of things that you can do that will put said athlete in a better position to not injure those structures, especially when you're looking at a female athlete. They are at more risk than anyone else to really tear that, especially with especially during certain periods within their menstrual cycle and the hormones that get released during that. They're at more risk for tearing it. So
you're going to be going out to the car for saying that, right?
Yeah, I know.
We're gonna take a quick commercial break, and if Rob is still here and alive after that, we'll talk to him some more.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
I'm Sierra from Ivy Rehab, and we are having an awesome Tuesday morning out here on the Radio Vision Network. So, Rob, before we left, we were talking about some of the more common injuries and some of the things that you kind of are seeing come through your office on a regular basis. Do you guys treat? You said that you treat all ages, from pediatrics all the way to the geriatrics. Do you guys see a lot of sports injuries this time of year as the weather and the outdoor sports start to become more prevalent? Do you guys see a lot of younger people coming in?
I don't think there's any particular season where we see more. It's just a constant flow of them.
Okay.
Kids are always hurting themselves.
Yeah.
That's part of being a kid, right?
Yeah. And I want to touch back a little bit on the ACL and stuff like that, you said there, you do some preventative stuff.
We do.
Tell us a little bit about, you said there's a test that you can do?
Yeah, we do a jumping test specifically for teenage female athletes.
Okay.
They basically stand on a 12-inch box, they jump down, they land into a squat, and they jump back up. During that process, we watch their knees, and we watch whether their knees kind of wobble inward or wobble outward.
Right.
And it gives us a good idea of what kind of stability they have. If they should be able to land, squat down, and come back up, and their knees should be able to stay right where they are. They shouldn't really go knock-kneed or bow-legged. If they do, then that indicates that some muscle group or some bands of muscle within their leg is not firing as efficiently as it should, which puts them at risk for what's called a non-contact ACL tear. A non-contact ACL tear is just an athlete who's running, decides to change direction completely by themselves, and the ligament will rupture. Versus a contact injury is obviously you're being hit, and then
Right.
that does the trick. So contact we can't really prevent it. It's going to happen.
Right.
It
It's
just
gonna
could be.
happen,
It's going to
yeah.
happen, right.
The non-contacts, though, are probably just as common, if not more common, than the contacts, if I'm not
Truthfully, I think
mistaken.
non-contacts are more common.
They're more common, right?
Yeah.
I mean, you see them on the professional level. A running back takes a wrong cut, or a basketball player comes down, gets a rebound, and turns the wrong way. These are injuries you see all the time where the ACLs they get torn and they're not getting hit by anybody.
A good example of a non-contact is actually Dominic McNabb.
Okay.
I
Who's
can't-
that again?
Yeah, exactly.
The other
When he-
man that took money from us.
Number
Yeah.
5 will always love you.
Yeah. He was running and he kind of ran off to the sideline. I don't
Yeah.
remember. You remember that
Yep,
game?
I remember.
It was the
Yeah,
Cardinals
just-
game. Yeah, I remember. I was
he was
there.
just kind of he was just kind of running and he just sort of fell over,
Yeah.
and then he got up and he fell over again.
Yeah.
Nobody hit him.
No.
But he just managed to plant his foot, twisted the wrong way, and that was all she wrote.
I think he scored 4. I think he threw 4 touchdowns that day. That day he got hurt. It was incredible.
You know what? Also, too, I hear a lot this meniscus, the meniscus tear, inner meniscus, outer meniscus. Like my buddy, he's a truck driver. He pulls the pallet off the truck. He said he was pulling and his leg just came. He was like, "What the heck's that?"
Yeah. So
Yeah.
your meniscus, just to give you kind of an update on it's two pieces of C-shaped cartilage that are inside your knee. It basically functions as a shock absorber. A lot of times it doesn't take much to tear it or damage it. You just need to place your foot or your leg in the right position, apply a certain amount of force to it, and if the meniscus is already unhealthy or there's weakness within the knee, you'll put it at risk for tearing.
Really?
The tricky part of it is that the inner meniscus, the one that's on the inside of the knee, not only attaches to the ACL, it also attaches to a ligament on the inside of your knee called the MCL. So the meniscus can be bad news because if it goes, it can potentially affect the other two, which now you really place the knee at a position that's a lot of instability.
Vulnerable.
Yeah.
Wow. Now you talked about, you obviously have tests that you can do to kind of gauge on your probability of having these things happen. What's some of the, preventative stuff? Can you strengthen the meniscus? Because it seems like it's a tendon. How do you strengthen that?
The meniscus is just cartilage. You can't actually strengthen that, but what you can strengthen is your quadriceps, which is the muscle on the top side of your thigh, your hamstrings, which is on the back side, your adductors, which is on the inside, and your abductors, which are on the outside. If you strengthen those areas, you basically strengthen the entire structure around the knee, and it'll provide the stability that it needs to provide when you're in an athletic situation. So when you put, for example, a teenage athlete or through that jumping test that I was telling you about, when they go knock-kneed or if they go bow-legged, depending on which direction they go, you'll know which set of muscles needs to be strengthened. So then you'll put them through a pretty aggressive strengthening program and a pretty aggressive agility program to really build the muscle and the stability in the knee so that way that non-contact ACL tear doesn't become an issue. Then you reassess them again and you see where they stand versus where they were the first time. It's interesting.
Now you say we're saying tears. Donovan McNabb, did he have a tear or was it blown? Or is it the same?
Same basic.
But he had to have an operation.
He did.
But I'm told that there's if you tear it, that it can be, without surgery, it can be healed by, I'm assuming, some of the strengthening tips that you're giving us.
So depending on what percentage of the ACL or whatever structure you're looking at, whatever percentage of it is torn will
Right.
dictate whether you need to have it operated on.
Right.
In McNabb's situation, he's a high-level athlete, he's a professional.
All right, all right.
You know,
We have to remember also that that was over 10 years ago. I want
Yeah.
to say that that may have been like 12 or
2004?
13 years
Yeah.
ago,
Yeah.
which means that everything has changed. Technology has changed, medicine has changed, health is, the information, everything, you know how fast things change.
yeah, yeah.
So in 12 years, this is a totally different scenario than it was then.
For the
Yeah.
average Joe, depending on how much is torn, is going to dictate whether it needs to be repaired or not. I mean, if you completely rupture it and it's 100% gone, technically you can actually survive without it. As long as you keep the knee strong enough, you'll be able to do what you need to do on a daily basis and not buckle.
That's why people can walk.
Right.
Yeah. I mean,
Right. Yeah, because they can typically get up and move around.
Right.
Now, if you're going to, if you're going to be any kind of athlete, even just kind of weekend warrior stuff, you're probably going to want it fixed because
Right.
if you turn
Yeah.
to a certain degree, it's going to buckle. And now remember, that ligament attaches to the other two structures.
Right.
Now you put them at risk because the stability's been compromised.
Right.
I want to switch gears real quick. You seem to really know your stuff. What's your training? What's your background? Where'd you come from, Rob?
So I went to Stockton College, which is now Stockton University.
Yep.
I graduated with a bachelor's and a master's, and I kind of graduated at a goofy time in PT where they were transitioning from a master's to a doctorate.
Okay.
So I started working full time, and I figured, I was young, I don't have many other responsibilities, so I went back and I actually completed my doctorate. So I'm one of those kind of weird hybrids that has all 3 degrees.
Wow. And all 3 are in physical therapy, or what's?
My bachelor's is in biology.
Wow. Okay.
The other 2 are both the master's and doctorate, both PT.
Okay, so we're talking to a really smart guy here. So he did it actually right. He learned the biology part of it first, and then learned the physical therapy, and that is the proper way to do it. Because if you don't understand the human body and how it all works together, you can't properly learn how to correct it when there are problems. That's
Right.
interesting.
Very interesting.
Cool.
We got to take a quick commercial break, and we're going to be right back.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
I am Mark Cook. That is Keith Reynolds. And we're talking to Rob Sierra from Ivy Rehab. And we have learned so much about the dynamics of what's going on over there. They have an awesome gym. They have highly trained physical therapists that are helping people get back to their daily lives after suffering an injury or a problem. And Rob, we wanted to talk a little bit about old folks. And
Why are you looking at me when you say that?
well, I wasn't looking at you. I was just kind of looking around you. You know, we've talked about some younger people. We talked about the high school athletes. We've talked about some of the younger folks. So now let's talk a little bit about the older folks and how we can help them live healthier lives and maybe change some of their thinking, because we know that older people may be stuck in their ways a little bit. How do you guys approach changing mindsets, changing lives, and making people healthier?
Well, before we go there, I think
Uh-oh.
it's getting up to the elderly. It just turned 50. I cannot do the things that I could do when I was in my 20s, obviously. Like, I'm sure you see those people that come in.
Yeah, absolutely.
So let's start with my group.
So, people come in and they say, hey, I'm not able to do this, I'm not able to do that. So what we do is we put them through a comprehensive exam. We try to locate where the deficits are, try to match them up to the complaints that they come in with, whether it be active pain or it's just pain or discomfort or dysfunction that they can't do. And then we kind of match that to the exam, and then we start addressing it. And it's kind of funny because it's still very similar to that young athlete. You're still looking for muscles that are weak, muscles that are imbalanced. Now, more often than not, muscles that are tight. So then you just address those issues, and I can almost guarantee you that almost everybody feels some kind of relief.
Yeah, it's a mobility thing, right? I mean, it's most older people that are having issues. It's because they're not moving around as well.
They say motion is lotion.
Real? Who says that?
I do.
You know, but it's important because when older people have an issue, I think that they wait the longest to get it addressed. Right? They put up with the pain, they put up with the discomfort for as long as they possibly can, Keith Reynolds.
Absolutely.
And then they finally go to the doctor, they finally go to the physical therapist, and it makes your job a little bit harder, right? So
Right.
I think that what we want to stress is that if you're feeling pain that you haven't felt before, if you're uncomfortable in your daily routine, your daily life, which you haven't been before, these are signs that you need to go make an appointment and go see Rob over at Ivy Rehab.
The whole idea of pain, you know, if you can think of it, it's almost like if your body has a dashboard like a car, pain is basically a light that's just popping on saying, hey, something's a little off.
Right.
You know, that's basically what your body's telling you.
Well, wait a second though. My check engine light has been on for like 8 months. So that's like is that the typical analogy? Like
That's chronic pain.
that's chronic pain,
Yeah,
right?
that's
So
chronic pain.
so in other words, don't wait 8 months when your check engine light goes on. Go right away, and I'm sure that I'm going to have a major issue when I go to the mechanic. But what you're saying is, when your body starts giving you a sign that something's not right,
Address it.
Right, but you know what though? I mean, do we have to, as far as, is there metrics out there? Like, I know anybody can do anything, you know what I mean? And there's people that are, you know, people say, oh, you shouldn't be walking around, like, I can't believe it, you know, you've survived this long or whatever. But is there like a metrics that you guys put in place to say a person of 50 years old, you know, they should be able to do this? Because, you know, you're obviously not going to be able to run a 100-yard dash when you're 50 and at the same time from when you're in your 20s. You know what I mean? And I use sports, but I'm just saying, you know what I mean?
Right. You know, that's a really tough one to answer because different people at different ages can do all different kinds of things. You know, and I just had this conversation with a patient recently. You can have a healthy 80-year-old and an unhealthy 50-year-old, and the 80-year-old will be able to do way more than the 50-year-old because of that health difference. The age part of it does not play as big of a role as most people think.
Okay, cool.
It's more what you eat, what you drink, how you sleep. Your overall health plays a
Right.
bigger role in your overall ability and functional mobility than the actual number.
You know, you said something about what you eat, you know. Now, look, I mean, some of the things that people come in, I'm sure, are talking like, you know, my knees hurt, my elbows, I'm constantly stiff. You know, how big does eating play a role? Like,
Massive.
huge.
because you know you got stuff that
Even I know that.
You know, hey, you know what? But I don't think people realize.
No,
that.
they don't. They don't.
You know.
Eating, what you eat and what you drink play a huge role in your overall recovery and overall how you feel. To give you the best analogy, if you bought a Ferrari, would you put cheap gas in it?
Me, yeah, but
Yeah, Keith
that's
would.
why
I
run the
wouldn't.
shop
You're
all the
right.
time.
I wouldn't. Keith would.
You know, you spend $500,000 on a sports car. Pony up a few extra bucks to put the good stuff in.
Yeah, but you know what though, Rob? Honestly, and I probably would put cheap gas in it, but you know what? But that's the way society looks
I
at their
know.
health too.
Right.
You know what I mean? Exactly.
Well,
I mean,
if you think about it, you can go to a dollar menu, you know, spend a couple bucks, and you've got enough food to really fill you.
Fill your belly, yeah.
But if you buy good food, and well, not only do you have to prepare it, so there's the whole time aspect of it, it's going to cost you a lot more than a couple dollars.
yeah, and you know, I think look, one of our first big interviews ever it was back on our WTR radio days, was with Carla Hall, and you know the lady that does Bravo or does the Chew on the Bravo network. But she was saying that most Americans, she said, Keith, if you had a piece of chicken and you cut it up into 20 pieces, does the first bite taste different than the last bite? And I said, no. And she says, why do us Americans like gorge ourselves with these big plates of food? We do, we overeat.
Oh, definitely.
You know what I mean? And I think the biggest thing is what we eat is important, you know, because like there's all different types of things that affect, inflammation in your body.
Mm-hmm.
And I'm sure a lot of that, you know, when you go in to do your testing, you're saying, all right, what are you eating?
Yeah, no, that's definitely something we bring on.
You know?
And especially water. Water is
Water.
a huge one. Drinking water can resolve a lot of issues,
Right.
soften the bite of pain, And I mean, even you have some people that come in and feel dizzy, just drinking water sometimes can rectify it without me even having to address it.
Yeah.
Right. You know what? I think that's a big thing, and I think that's probably why I don't, like, you know, when someone makes and pains, probably why I don't feel it worse, because I am a water drinker. I
Yeah,
drink
that's good.
tons of water.
That's good. And what most people don't realize when they feel hungry is that they're not hungry. And if they had a glass of water or a handful of almonds, that would satisfy them enough. But the problem is we're trained is that as soon as you think you're hungry, you just eat.
Yeah.
Yeah.
Or a lot of people do.
Actually, there's a lot of statistics now that say that the majority of the population are actually dehydrated.
Mhm.
And so
I believe it.
their hunger pain versus their thirst pain are so blurred
Mhm.
that they immediately go to the food and not the thirst.
Right.
And that if you would just drink a glass of water, that may be enough to satisfy it.
Well, you know what? If they can make a glass of water smell like a burger,
Yeah,
we would
there you
be
go.
in business. That's what we gotta do. Make
I-
burger water.
That sounds.
Burger flavored
That
water.
is the worst idea I've ever heard.
Come on, man.
That is terrible.
All right.
But like one of the things that people can do, and we've had a lot of health experts on, and a lot of things
Yeah.
that people can do that's very very simple is like cut out sugar, cut out soda,
Soda,
cut out
yeah.
that other stuff that really you don't need it. There's no benefit to it. Okay, a Coca-Cola tastes good, but is it really worth all of the negative health benefits it is to enjoy that to enjoy that drink? It's about making simple choices, better choices,
Yeah.
living better lives, and then when there's an issue that you need addressed, you go see Rob at IV Rehab, right? It's not that difficult.
No.
I don't understand why people make it so hard on themselves.
You know,
Rob.
it's a lot easier than a lot of people think. A lot of people think you have to go and see a physician first before you go and see a PT. You don't.
It's not true.
Jersey's considered a direct access state, so you can literally just walk in and make an appointment immediately. And
Yeah.
That's it.
And your doctor probably will thank you for saving his time,
Yeah.
right? Because
We have a lot of physicians that we have good relationships with, and the patients will come back and say, you know, hey, X, Y, and Z hurts, and we'll write it up. We communicate with the docs, and the docs are usually like, great, glad you
Yeah.
guys are taking care of it.
that's awesome.
You know,
All right.
That's awesome.
So, Rob, tell the listeners and viewers out there where they can find you guys. All your information.
So we are located on Route 130 in Cinnaminson behind the Sam's Club. We're on 2200 Wallace Boulevard, so we're in the mainland commons back there behind the really Walmart more than Sam's Club.
Okay.
How about a website?
Website?
IVRehab.com. And it's not just for my office, it's for all of the offices. So there's 43 of them in the company.
There's 43 offices
43 total.
nationwide.
Yep, we're located in Jersey, New York, Connecticut, Illinois, and Indiana.
Wow.
Excellent. Now, when I go to the website, will I be able to contact you or?
Yeah, absolutely.
Okay, so I can go to ivrehab.com. I'll be able to get in touch with you. How about any social media or pages like that, Facebook?
There is an Ivy Rehab Facebook page. Again, it's not local. It's a company.
But search it out and check it out.
Yep.
It'll give you a little bit of an idea about the overall company at Ivy Rehab, their mission statements, and all the things that they're out to provide for their patients. But then you can get the specific information for Rob and the Ivy Rehab location over there in Cinnaminson, which has the gym and the fitness center attached to it, which none of the other Ivy Rehab facilities have in this area. And that's really
they don't have
an
the gym.
amazing
What's
special.
up?
They don't have the gym?
Rob has
Well,
the gym.
I mean, Rob, yours has the gym, but the other ones don't?
No, the other ones are just PT offices.
Correct. So that is why Rob's office is a little bit more unique, and I'll use the word special because it's got more going on. They have a gym as well as the physical therapy office.
Right.
Very
Okay.
cool.
All right, Rob, thank you so much for coming on.
Thank
We're
you.
going to have you come back because there's a lot of topics that we can talk to you about.
Definitely.
Absolutely.
That I would love
I'd be
to
more than
talk
happy to.
Okay,
Great.
Sounds good. We're going to be right back with Morning Coffee right after this with our next guest.